Our case is a 20-year-old female patient immediately post PCL surgery. There are 5 active phases of her rehab program. The 5 phases are documented in the following videos.
So the first exercise we'll be doing today will be to do some patellar mobilisation. So it's really important after surgery to increase the movement around your kneecap. So I'll get you to do these movements for me. So put either hand either side of the kneecap for me. And I'll get you to push it from side to side, really nice and slowly. Even slower than that. And to the left, and to the right, to the left. That's good. And we can change it up a little bit. We're going to go up and down as well. So yeah, place your fingers. That's it, exactly, yeah. Up and down, nice and slowly. That's really good. Okay, so we're moving on to the next exercise, and what I'll get you to do, it's called the ankle pump. So what I'll get you to do is pull your foot back towards you. That's it, and then push it all the way down as far as you can, and up, and down. So it's like a rhythmic motion, and we're facilitating the fluid drainage from the lower leg. Okay, so the next exercise we'll be doing is stretching the lower leg muscles, the calf muscles. So first thing I'll get you to do is pull with your hands, and you're going to pull your foot back towards you, and you should feel a stretch, a light stretch through your calf muscles there. Yeah? So that's stretching gastrocnemius. And to stretch the other calf muscle, you're going to place a bolster underneath the knee there. Is that comfortable for you? Yep. And doing the same thing, pulling your foot back towards you, and you should feel a slightly different stretch. So it's targeting a different muscle. Can you feel the stretch there? Yep. Okay, so the next exercise we'll be doing is called the quad setting. So what I'll get you to do is just tighten the muscles at the front of your thigh for me, as if you're pulling the back of your knee towards the table. When you're doing it, I'll get you to hold there for 5, and then relax. And again, and relax. Okay, so once you've completed doing your exercises, I'll get you to put your knee brace back on, and I'll get you to stand up with the 2 crutches for support, and I'll get you to actually weight bear on the knee. It's really important to get weight bearing straight away after surgery.
The next exercise for stage 2 is going to be used to maintain an extension in your knee. So what we're going to do is get a towel and place it underneath your heel, and from this position we're just going to leave it in extension. During this, normally you leave this for 5 minutes. During that 5 minutes you can continue on with what you were doing previously, which was quad settings. So if you were to contract your quads, hold it for 5 seconds and relax. Okay, so the next exercise we're going to be doing is called short arc lift. So what's going to happen is you're going to be contracting your quads and lifting your heel off the table and holding that for 5 seconds. So go ahead and relax, and again, and relax. Okay, so the next exercise we're going to be doing is called a heel slide with an assistance of the towel. What's going to be doing is going to be stretching off your quads, as well as beginning a bit of range of motion into the flexion of the knee. So what you're going to be doing is, with your arms, you're going to pull on the towel, making sure you're not contracting with your legs. Once you get to about around here, and once you feel a stretch in your quads, you're going to hold that for 5 seconds, and then you're going to release off. And again. Hold it for 5, and relax. Alright, the next exercise is going to be strengthening of your hamstrings. So what you're going to be doing is this is isometrics of it. So what you'll be doing is digging your heels into the floor and holding that for 5 seconds, contracting your hamstrings. So go ahead and relax, and then again.
Okay, so for the first exercise in stage 3, what we're going to do is straight leg raises. So similar to the quad setting you've already done in the previous stages, I just want you to contract your quad muscles as hard as you can. Beautiful, and now raising your leg straight up into the air, stopping about there, maintain that contraction, and now slowly lower back down. Very good. Contract again. Lift the leg up, making sure your leg's nice and straight the whole way through, and slowly lower back down. Perfect. Okay, for this next exercise, what we're going to do is called hip abductions. So just lying down how you are, this top leg completely straight. I want you to slowly just bring your leg straight up into the air to about 45 degrees. So yeah, that's good. And slowly lower back down. Beautiful. Okay, for this next exercise, what we're going to be doing is standing hamstring curls. So just holding on for balance. At home, you can just use a wall for balance. And what I want you to do is just bend your knee and bring your heel towards your bottom, just about 45 degrees. So that's perfect there. And back down. And go one more time. And back down. Good. So if that's too easy at home, you can use a light ankle weight to just make it a little bit harder. Alright, for this next exercise, what we're going to do are wall slides. So just get you to have your feet about shoulder width apart and about 30 centimetres out from the wall. So just leaning back against the wall, keeping your back straight. I want you to bend at your knees and go down to about 45 degrees. Yeah. And hold that for 5 seconds. And come back up. Perfect.
Okay, so for the first exercise, stage 4, we're going to do the step up down exercise. So what I'm going to get you to do is place your operated leg up on the stool. And what you're going to do is you're going to hold on to the pole for balance. You're going to step up, fully extending your knee and contracting your quads. And then slowly lower down to the ground. And again. Okay, next thing we're going to work on is proprioception, or your balance. So the first thing I want you to do is holding onto the pole. I want you to stand on your operated leg and just lift the other leg up. And I just want you to try to let go of the pole and hold that for 30 seconds. Yeah, good. Once you can do that easily, we're going to progress that to eyes closed. Do the same thing with your eyes closed. Again, holding that for 30 seconds. Yep, and then lastly, if we're good enough at that, we're going to use a wobble board or a pillow, stand on that, and try to keep that balance for 30 seconds. So next exercise we're going to do is a hamstring stretch. So what you do is place your leg up on the chair with a slightly bent knee. I want you just to lean your torso forward until you feel a stretch in that back of the thigh. And we're going to hold that 15-30 seconds.
Alright, you've been progressing quite well with your exercises, so we're going to get you to start doing some weighted machines. So this one's your quad strengthening. So we start off with some low weights. So if you get your leg and you straighten out, keeping your hip in neutral. Good. And all the way back. Good. So while you're at the gym, you can use other machines such as your hamstring curl machine or your calf raises. Alright, we're going to move on to some more dynamic exercises. So we'll do some sprints. After the sprints, we'll do some more zigzag sprints as well. So if I get you to sprint up. Now we're going to do some more dynamic exercises with sideways jumping. So 2 feet together, and we're going to jump to the side. And to the other side. And more. So same exercises, but this time we'll just use one leg. So if you go on your right leg, and you hop to the right, and another way. And one more time.